Hello everyone. Welcome to today's session. Thank you for joining us. My name is Amir. I'm a third-year medical student at IUHS School of Medicine. Today, I am very excited to introduce to you guys Dr. Abhinav, a recent IUHS graduate who matched into neurology residency in California. It was not too long ago where Abhinav, I was getting advice from him, and I would just call him Abhinav. But now I have to call him Dr. Abhinav. There's a lot of formality there. And he's taking a lot of time to reply to my messages. So he's a lot more famous, a lot more in demand. But we're lucky to have him here with us today. So Abhinav, before we get started, why don't you introduce yourself to us?
Sure. Hi, Amir. Nice to see you again. And good evening, everybody. My name is Abhinav, and I recently matched into neurology residency in California, in my first choice. And I'm a recent IUHS graduate as well. So I was in your shoe not too long ago, and it feels really good to be on the other side now when everything is like done.
Yeah, honestly, you've helped me so much throughout my clerkship years. I mean, now that I've begun. For those who don't know, Dr. Abhinav, he was my chat GPT when it came to clerkship related things, questions. I'd go to him about anything, and he's been very helpful to me. And hopefully, throughout this interview, I'm able to extract as much information for you guys about the clerkship years and also matching to residency that is going to help you guys moving forward. So, before we begin, I want to get some background information from you, starting with what inspired you pursuing neurology.
Sure. So I actually went to med school for neurology. Little bit about my background. I worked as a physical therapist. I did my doctorate in physical therapy from Arizona, and then I did like a separate course in neuro rehab, neurovestibular sciences, and all, and I started seeing a lot of neurology patients who needed rehabilitation. And during this whole process, I was in clinical, like seeing patients and making connections with the neurology physicians and other doctors. And I'm like, oh, I want to be one of them. I want to be a neurologist. And that's when I started. I remember I was like 6, 7 years into my profession in physical therapy, and I started looking into like different school options, like what is the pathway to be a neurologist or to go into neurosurgery, just the neurosciences overall. So it was either neurology or either neurosurgery. And then started looking for schools, and then came up like, oh, either you go to a US med school or either Caribbean. Of course, Caribbean was little easier to get in. So that's when I started my journey into medical school. And overall, I would say I'm always been fascinated by how the brain like shapes everything in our day-to-day life, and I found myself constantly drawn to neurological cases during my work, during my clinicals, and I just love the mix of complex problem solving and opportunity to connect with the patients who have some neurological disorders.
Wow, no, that's really good. This contrasts a lot to the typical medical student who doesn't have exposure to the field prior to getting into medical school. Like myself, I finished undergrad, I had no exposure to medicine and the medical field. I had very limited experience and exposure, and I just applied into it. And when I got into IUHS, I had no idea about what I wanted to become. But in contrast, you had a lot of exposure, and you even pursued medical school for neurology to begin with, which always helps knowing what you want to do. Um, and before we get into your experience with the online preclinical years, which is unique to IUHS, tell us what influenced your decision to attend the IUHS School of Medicine as opposed to a USMD school or even other Caribbean medical schools.
Sure. That's, I think, one of the most famous questions I've always been asked by current and the prospective, the future medical students.
Mhm.
I've been getting a lot of messages on LinkedIn and other platforms like, hey, why did you choose a UHS? So I think my number one answer would be flexibility. It's very hard to, when I was researching different schools. I remember I contacted even California Medical Board to see like, hey, if I go to this school, would I be like eligible to have a license and everything in California? And they said like, yes, you will be. And that was my point, like where I'm like, okay, I need to I need to apply and get into start the medical school. And then mostly I would say I choose IUHS because of its strong US clinical network, where you can do all your clinical rotations in US if you live in US. And if you want to pursue career in like in medicine in US, and then even if it meant, taking a less traditional path, like going to Caribbean or like IUHS distributive online learning, it offered me the opportunity to grow both academically and personally while keeping my employment, which was very important to me, to take care of my finances and the family and also, yeah.
Yeah, that's very good. And people really don't, they underestimate how significant the convenient factor is. It's not about just being at home. That brings along with it a whole laundry list of things you don't have to worry about. And then when you also add employment into the mix, where you're able to still remain employed, do your work, work up a salary, that's really good. Um,
And it takes care of the finances as well, which is the biggest factor when you are in a medical school. Doesn't matter you are in US medical school or Caribbean or anywhere in the world. Finances, I think, is the number one worry at the back of the mind in each medical student.
Yeah, of course. And even right now that I'm interacting with different medical students from Caribbean schools at my clerkship sites, at the hospital, at the clinic, a lot of times we inevitably talk about how much debt do you have at this current moment. And when it gets to me, they get shocked that mine is just a fraction of a fraction of a fraction of what they have. Um, and it really is a relief for me at this point.
Yeah,
Um,
and the beauty is that at the end when you match, nobody is going to like ask you like, oh, did you went to this school and how much debt you have and all those things. You are a medical graduate once you graduate and you match. So
Yeah, exactly, exactly. So one of the very unique components of medical school with IUHS, which I get a lot of questions about, is the online nature of the preclinical years. So why don't you tell us a little bit about how you adapted to the online format for your preclinical years?
sure. So it definitely took some adjustment at first. It wasn't as easy because I did my master's in Michigan. It was in class. I did my doctorate in Arizona in physical therapy, which was 3 years of in class. And then all of a sudden, during the COVID era, we are going into online. But I think the beauty is that during COVID, when I started my medical school, everything was online. Even all the US medical schools and schools around the world, all were online. So I'm like, okay, there is, and IUHS is not like purely online, it's like a distributive online learning. So where while you are in blocks, you are still going to your mentor and attending some clinical hours and acquiring some of the real world things that you learned during the in-class lectures. So, but I created a structured schedule. I stayed disciplined where I have like, okay, I want to attend as many live lectures as possible. And I did. I think I probably attended at least 80% of the live lectures.
Oh,
And,
wow.
some of the active study techniques like spaced repetition. And then IUHS has a lot of weekly quizzes. I remember taking those weekly quizzes about the current what they are teaching you and all. And then you have a lot of time with the professors at the end of each lecture. So if you have any doubts or anything, you can ask them. So I was nervous at first, but then I remember during the block 3 and block 4, I'm like, okay, this is good. I'm just adapted to it. So all it took me like maybe 2 blocks, and I was like just sailing into it.
hmm hmm It's such a good point that you mentioned the whole mentorship component of the preclinical years, because I always forget about that. But it's so important because it really, because IUHS provides a lot of support to even your mentors wherever
Mhm.
you are. So for mine, it was in Toronto, and they give a whole like checklist of clinical skills for every single system that you need to learn, so that when you do enter your clerkship years, you're not behind other medical students. So that was definitely very helpful for me because now I'm in pediatrics. And when I have to interact with patients on my own, I know how to carry myself. I know what examinations to do, what assessments to do. So it's very important that you mentioned the the mentorship component of the IUHS curriculum. Um,
Because it helped me a lot. I remember going to physicians' offices and they would ask me like, "So what are you studying nowadays?" And I remember, I think it was block 3 or 4 when we were studying like cardiology and all. And
mhm.
I told him like, "Oh, we are studying a lot of like cardiopulmonary sciences and respiratory and all." I don't remember what block it was, but we were studying cardiology. And he goes like, "Oh, we have a patient with the AFib and CHF, how about you go and just chat with them?" And I told him like, "Oh, I don't know what to ask." And he goes like, "Well, ask whatever you learned from your school." So I knew like during the in-class lecture, I learned these certain things about CHF, like, oh, during if they lie flat, they have shortness of breath. If they walk too much, they have shortness of breath. So I was asking those questions and he was sitting next to me and he goes like, "See, everything you know things, what at the level of medical students." So that's why I said like it's an online distributive learning where you combine the virtual lectures with the like the clinical component of it, which you learn at the physician's office.
Yeah, that's a very good point. Just building on the preclinical years, what school resources, so that could be faculty support, study tools, curriculum structure, uh, which one or which of those school resources were most helpful in succeeding during the online preclinical phase?
Yeah, so during my time at IUHS, we had a lot of different resources. Recorded lectures are really, really good. You can watch them anytime when you are studying and all. Uh, they are accessible at any time and then access to the professors through their email. And most of the professors, I remember, they gave their phone numbers, like their cell phone number, like, "Hey, if you have any question, you can text us." And then some other resources are Lecturio, and I remember using Lecturio, and Firecracker was another resource. So a lot of all these resources help me to stay organized, and the whole structured curriculum created by IUHS for their medical student, it just kept me moving forward even during the uncertain times when I was like, "Am I studying it correctly? Is it going to achieve my end goal of studying for step exams or taking my USMLE exams and all?" But it all went well.
Yeah. Did you have friends at the time at IUHS, like peers that you studied with remotely, or was it just you and yourself and your monitor?
So I was very lucky and fortunate that during my class, we created a WhatsApp group, um, which is, I think, still somewhere around.
Hmm.
And most of us would like do Zoom calls or on the days off and all, and we would study together. And it was very, very helpful. And they all motivated each other. They all helped each other. And then because I was working as a physical therapist at an academic hospital, so I was still interacting with some of the medical students from UC Davis School of Medicine because our hospital hosts them. So those were some of my other resources.
Hmm. Very good, very good. Yeah, I think I had one as well, a WhatsApp chat with fellow students, and it helps studying with people on video call, on even
Mhm.
voice call, just to know that someone is suffering with you. It helps reduce your suffering just a little bit.
Yeah.
Um, so we talked about the preclinical years. We talked about the unique hybrid nature of the preclinical years with IUHS, with the in-person mentorship program. We talked about the recorded lectures, which were very helpful, very convenient for structuring your studying. Um, Now I want to transition to the clinical rotations where I'm at right now. Um, and first begin with asking you, were there specific rotations or faculty mentors from our school's network that helped shape your neurology interest or strengthen your residency application?
Sure, but before we move into that, I want to congratulate you because I know this is the most exciting time when we are in clinical rotations. I was so happy that I don't have to like study every day now. Of course, you still have to study for step two and all, but it's just a different feeling, right? It
Yeah.
gives a sense of achievement, and it I remember it also gives you a sense like, okay, you're one step close to a matching.
Yeah,
And
sure.
so I want to congratulate you on passing your step exam and moving close and close to match.
Thank you. Thank you. I appreciate it.
But yeah, to your question, yes, IUHS helped me tremendously. I had my own different pathway to match into neurology. I was like, I want to stay in California if possible. And some people from IUHS, especially Clark Kinovitz, he is the director of clinical clerkships, helped me a lot. My all of my neurology rotations and non-neurology rotations were all of them actually were first time like making contract with IUHS because I did most of my rotations in California. So at that time, IUHS did not have contract, but Clark was open to help me with support from Dr. Mary, who is the dean of our IUHS school. And they
Mhm.
both were super helpful. I remember communicating with Clark many, many days, going back and forth between the hospital and Clark, and to getting the all these contracts in place so I can rotate with all these good hospitals. And I was happy that I was able to achieve those goals. And big shout out to Clark. He helped me a lot. I even rotated at UCSF in California, which is very in high demand for all medical students. But Clark made it possible. So yeah, big shout out to him.
Big, big, big shout out to Clark for the assistance with the clinical component because I'm also interacting a lot with him because I'm in my clerkship years. So I definitely know what you're talking about when it comes to how helpful he is. Um, so now regarding your rotations themselves, one component which is really, really important is securing strong letters of recommendation because this is going to make up a very a huge bulk of your residency application. How did you go about securing strong letters of recommendation? What advice would you give to fellow IUHS students who are in their clerkship years?
Yeah, so one thing is, I know every medical student during their clinical rotations is like, oh, I need a good letter of recommendation. And ERAS, which is the residency portal, only allows you to upload 4 letter of recommendations. Most of the programs, when we apply, they recommend like 3 to 4 letters of recommendation. And one of the most important component when it comes to letter of recommendation is it should be written by a person who knows you very well. It's not about their credentials and all, it's about how well they know you and how well they know your work. So, the advice I have is number one, ask early and ask people who really saw your work ethic and your commitment to medicine. So, again, it's not just about the title of the person who is writing the letter. It's about how well they know you, how well they're going to write or put you on a piece of paper, what they saw in you in the 4 weeks or 6 weeks or how much ever is the duration of rotation that you spent. Because you can get a generic letter from Google and programs know, program directors have been reading these letters for many, many years. So they know how to differentiate a good letter, a good legit letter of recommendation, which defines you because they will read your personal statement, they will read your CV, and then they will read the letter of recommendation. So they know how to connect all those dots. So when this, like, they read your CV, they read your personal statement, and then you have a generic letter of recommendation which doesn't really define you, it will take them a minute to catch that. So that's why I said like ask to those who you think like how well they know you and how well they write about you.
Yeah. So two questions that are of my own actually right now. Um, so for example, I'm doing my pediatrics rotation right now. When I apply for residency next year, it's going to have been at least one whole year actually, um, since I did my pediatrics rotation. So my peds um, you know, the person that I'm doing it with, he's still gonna have forgotten me by then. So how do you navigate that? Because what if you take a rotation, if I'm interested in pediatrics, and then my core rotation in pediatrics, I took it a whole year before I'm applying for residency, the guy will most likely forget me. That's one question. How do you navigate the timing? And number two, how do you choose who to ask in terms of the specialty they're in, right? Because I'm guessing when you apply for residency, they're hoping that if you're applying to neurology, you're getting a lot of recommendation from someone in neurology, related to neurology. Um, so how do you choose who to ask in the 4 years? Besides, them knowing you very well, what about how do you choose um, which fields to ask from?
Yeah, sure. That's a good question. So answer to the first part, I think you asked me like how do you ask if you are a year away from applying to a match? So it never hurts to ask them early if you know from the beginning that you are going into, let's say for in your case, it's pediatrics, that you are going into pediatrics, then most likely you will do in your fourth year, you will do electives in pediatrics, right?
Hmm.
That's why we have this whole fourth year to do the electives and the subspecialties and do the rotations that you want to go into, specialty you want to go into. So that will be your another chance to ask for more letter of recommendations. But then even in your third year co-rotations, you can ask them like, hey, during the middle of your third year rotation, like, hey, I'm really, really enjoying working with you and I'm learning a lot. Would you feel comfortable writing me a letter of recommendation? And this, you gave them an open-ended question. And if they feel comfortable, they will say yes. If not, they will say, like, you know what, I have a lot of work at clinic. I don't think so. I have time and resources at this time to put into writing a good, strong letter of recommendation. So no hurt, no bad feelings or anything. But you can always ask early and they can write you a letter and they can save it somewhere in their office because ultimately it's the physician who is going to upload it to your ERAS portal. You
Mm.
can't do it by yourself. It has to be a whoever is writing the letter. So you can send them. So once they write you a letter, they can save it in their office. And then once the time comes, then they can upload it to your ERAS. You just have to share a link from ERAS to them. It goes to their email and it gives them all the directions how to upload a letter and everything. And they can upload it when the time comes.
Hmm.
And then answer to your second question, how to ask, like which specialty to ask. We do 6 co-rotations during the third year. So the most safest one when I was applying to neurology, I had one letter from internal medicine. Internal medicine is the core branch of medicine. It doesn't matter you're going into neurology, psychiatry, pediatrics, everybody will accept a letter from internal medicine rotation because they know you spend a lot of time, 8 to 12 weeks in internal medicine, and you learn the core concepts of medicine. So physicians usually, or attending physicians usually get to see you growing as a medical student who is like when you start your internal medicine rotation, you don't know much about the clinical part of medicine. And then you learn these 8 weeks or 12 weeks, and then you suddenly grow into a good, like excellent medical student, hopefully.
Hmm.
So internal medicine is the most safest. But if you're going into a surgical specialty, then ask a letter from a general surgery attending physician. So uh, usually they recommend, like when I applied for neurology and neurosurgery. And for my neurology, I had couple letters from a neurologist and one from internal medicine. For my neurosurgery, I have a letter from a neurosurgeon and letter from a general surgeon as well, and a neurologist letter. So
Hmm. Smart, smart. So I was actually going to ask about how the school provided support for your clinical experience, but you already answered it with two questions ago about how Clark was very helpful with, the whole process of arranging a contract with UCSF, I think it was,
yeah.
which is a very reputable, very established medical center. So good for you. So I'll go to the next question, which was how did transitioning from an online preclinical education to an in-person clinical rotation impact your learning experience? So even for me, now that I'm doing it right now, the first week there's a huge shock factor because you're not used to seeing people, right? You're used to seeing your monitor, your first aid textbook, and that's about it. So how did transitioning from being online to in person um, go?
Sure. Definitely it was a big shift, but a positive one. For me, it wasn't really bad because, as I said, I was working in the hospital. Um, Even when I was working as a physical therapist. And then during the like the first two preclinical years, as I said, there was this distributive component of IUHS where you actually go to a mentor and spend 20 hours each month, I believe, something. And then, so it wasn't a big shock, but definitely it was a big shift. And I was very happy, excited, but nervous at the same time. But I would say clinical brought the material to life and helped me to apply what I learned in those 2 years, especially what when I was learning during the step one and all, and being face to face with the patients, listening to them, and like listening to their complaints and listening to their concerns, and then connecting those dots. Like, oh yeah, I learned this. I remember this when I was studying for my step exam or during the academic curriculum exams. So being face to face with the patient gave me a whole new level of understanding and the motivation to keep going. So yeah.
That's really good. And I think w one thing that influences that a lot is your first rotation, what it is, and the site that you're doing it at. I was very fortunate, very fortunate that I began with psychiatry at a very good site, and the staff were very welcoming. I've read a lot of like horror stories on Reddit and different like platforms about how there was a lot of like negative, toxic culture where they were at. But thankfully, the sites that IUHS has us going to, the staff have been very welcoming, very understanding, and don't expect you to save lives on day number one. Maybe by the second week, but they still give you time to integrate into the whole system and everything.
Yeah, I would definitely say stay away from Reddit. For the clinical rotations, I think IUHS prepares us well during the preclinical years, give us enough material and education to be prepared. You were lucky that you started psychiatry. I started with internal medicine, which is a 12-week rotation. And I don't think at any point, and I was with other medical students from different schools, and I never felt, honestly, during my third and fourth year rotations, I never felt like I was underprepared or oh why did I went to IUHS or online distributive learning versus like a traditional US medical school. So when attendings would ask us questions, I would know the answers that were expected from a medical student. Not all the answers, but most of them. And I felt like we were all, even the US medical students and me, traditional, like a non-traditional Caribbean medical student, we all were at the same level. So
Mhm.
yeah, you actually crave your pathway to rotations. It depends how good and dedicated you are. So don't worry about the Reddit posts and all. People complain when things don't go in their way, right?
Yeah, no, that's a very good point. I wish I stayed away from Reddit
Yeah.
the night before taking my step one because there was like a lot of like posts about people, oh, they changed the entire question bank. Nothing is high yield anymore. But yeah, so definitely stay away from Reddit. And what you said about your competency being something that you dictate yourself is a very good point. Because even with my rotations, I have a lot of medical students from US schools and other Caribbean schools. And I realize how competency isn't something which is just given to you. It's something that you have to subjectively, individually work on, right? You could go to a US medical school and be incompetent or competent, and go to Caribbean school and be incompetent or competent. It really is what you make it out to be. Um, so
Yeah,
that's,
I remember I would come back, or even during the free time at the rotation, I bought a book, Step Up to Medicine or Step Up to Clinical Medicine. It's a good resource for rotations and USMLE Step 2
Mhm.
preparation. And it just gives you a flow of clinical information, lot of like in-hospital practice internal medicine. So I found it very useful. I remember I would read it, and then physicians would ask me like, oh, what are you reading? And I'm like this, and they go like, oh, look, we have a patient, let's go see them. So those type of things were very helpful. So yeah, you dictate yourself how good you want to be and how well you want this rotation to be.
Very, very, very good points. All right, so now we're at the last stretch of this interview. Dr. Abhinav and I have both got our gray zippers on from IUHS. We're repping it. It's honestly, I don't know about you, but I've gotten a lot of compliments on it from different medical students. So I'm glad that we both got it on for this part of the interview.
Yeah, I have my IUHS jacket on, nice fleece Columbia, and then I have a nice IUHS polo. I actually wear it to work as well, because so people can see, and then they go like, "Oh, this is the med school you went to." I'm like, "Yes," because now they know that I matched and everything. So it's a yeah, good
Yeah,
way to
that's
show,
good.
good IUHS swag, right?
Yeah, yeah. No, I definitely urge a lot of the students
Yeah,
to get this zip up because you get a lot of compliments on it,
yeah.
and that'll help compensate for a little bit of the moral crumbling you get from UWorld. Um, so anyways, let's transition to the last stretch, which is going to be a residency application and matching into a specialty as competitive as neurology. And not only did you do that, but you matched into a very competitive place as an IUHS student. So firstly, I want to ask you about the strategies that you use to make yourself a competitive neurology applicant.
Sure. I think as I said earlier, I knew that from the beginning that I want to go into neurosciences, so either neurology or neurosurgery. More into neurology because neurosurgery is a long program, 7 years. So I'm like, I, I don't know how I will feel about spending another 7 years. But I was like, I want either neurology or neurosurgery, primarily neurology. So during my whole clinical years, I focused on excelling and doing well in my clinical rotations, especially in the neurology and neurosurgery rotations. And I made sure that my personal statement reflected my passion into going into neurology or neurosciences. And then I also applied broadly, pretty much across the US. And I networked actively and prioritized some of the programs, ranked them high, where I had done electives or where I knew that I have good chances of going into. One of the other things that helped me a lot was I was a member of the American Academy of Neurology, and I did some work for them, which included I was attending their annual conference, which is usually every year in a different city. And not this year, but the last year it was in Colorado. And I was lucky to do a whole presentation about traumatic brain injuries and concussion. And the meeting has about 15,000 like professionals from all over the world. So it's a big networking opportunity. And I still remember at the end of my presentation, there were about 150 people in the room, or maybe 200. And at the end of the presentation, when we were like meeting and juggling, like talking with each other and all, and a lot of physicians, they asked me like, what is your interest? What are you thinking about your residency? And I told them like, oh, I want to go into neurology. And then they started telling me about their programs and all. So I think that helped me a lot. And then similarly for American Academy of Neurology, I did a video on carotid artery dissection, and that video has been available on their website. Anybody can watch that video. It has my name on it, and I can do the citations on my ERAS application. So overall, my view is like you have to put in effort to show it to the programs, and then they know like, oh yeah, you're doing all these extra things and balancing your studying for step exams and clinical, other preclinical and clinical years, and other like shelf exams and everything. So you really like dedicated into a profession. And I think all those things collectively, it's not just like one thing, like, okay, get a good USMLE score and you're good. No, you have to like show a passion like that you really want to go into surgery or neurology or OBGYN, whatever is your taste. So yeah.
Hmm. That's a very good point. Because I'm at the stage right now where I'm thinking ahead and I'm thinking, okay, when I apply for anesthesia, for example, in the future, which is what I'm leaning a lot towards, what can I do right now to show that this interest didn't occur in the last 1 month of my application cycle? I've had this interest for a long time. So what you mentioned is very important. I have to start looking into the societies, um, different associations that are, anesthesia related, and this obviously applies for everyone else. So whatever you're interested in, whether it's surgery, anesthesia, pediatrics, psychiatry, neurosurgery, if you want to sacrifice 7 years, whatever that it is, start looking into it early on and to show that, your interest in the profession has accumulated over time.
Yeah, and as you mentioned, like if you do things like 1 month before your residency application open, which is it usually open third week of September, ERAS, that's when the ERAS open and you submit your application. Programs will know, like, oh, you're putting everything in, like you did things in August, like a month before. So they know, like, oh, okay, because you just want to apply to that specialty, you are just showing off like you started things like 2 months before. It has to be like an ongoing, because, residency match is a very, very competitive process. It's a hectic process. You are competing not with just the US medical student, not with just the Caribbean students. You are competing with the rest of the world, and there is about 50,000 or 40,000 medical students who apply for match each year, but they don't have that many spots. So unfortunately, a lot of them go unmatched. But then I think if you start early and prepare and make your CV in a way that it reflects what you want to do, it speaks for itself. And then I think there are high chances of successful matching.
Very, very, very good points. So, students like myself, you're watching this, make sure to, don't have to know immediately in third year or first year, second year what you want to do, but at least expose yourself to different work environments, volunteer opportunities, experiences, so that when you do apply eventually for your residency, you show that you have a track record of actually being invested in your field of interest.
Yeah,
So
usually in your third year, you will know what you want to do
yeah,
because those six core rotations that we do pretty much cover most of the medicine.
yeah.
So you have enough time in surgery, you have enough time in clinical medicine. So you will find your niche, like, okay, this is what I want to do, and just invest your time and efforts into it.
Very, very good point. Um, so just building off of the application process, because I think everyone has a lot of curiosity surrounding that. How did our school, so IUHS, did they help with guidance on the personal statements, preparing for the interviews, with just match in general?
Yeah, for sure. I remember I received an email from Dr. Mary saying that, oh, share your personal statement with us. When I finished my personal statement, I shared it with Dr. Mary, and he recommended some of the edits. And because, he does this every single year with a lot of students, so he knows the ins and outs and what really stands out and what needs to be in there and what not. And also he sent me, I think within a week, he sent me a revised version. Like, here, these are some of the recommendations from school. And
Mhm.
then I remember Paige Stewart. She is the admission director. She also messaged me actually on WhatsApp saying that, hey, if you need, I know you are going into a match this year. If you need any assistance on a personal statement or anything, just reach out to us and we will definitely help you. So, you know that there are people out there who are there to support you during this tough time because you are doing your rotations during that time. You are a full-time rotator somewhere, and then you are juggling all these things, and you're preparing for step two, and you're thinking about writing a good personal statement which fits into 1 or 2 pages. Because I remember the first personal statement I wrote was like maybe 1,200 words, and it was like 3 pages or so, and then I have to condense it to like 600 to 700
Oh,
words.
wow.
And it's really, really difficult. I'm like, I don't want to skip this, I don't want to skip that, but yeah, our school have plentiful resources for all the students who are going into a match process. I felt well supported throughout the process.
Hmm. Yeah, just to jump on the Dr. Mary bandwagon real quick, she has been very, very helpful even to me, and I'm sure to all the other students at IUHS. And I don't think you find it that often where the dean of a medical school who has already um, a ton on his own plate makes sure to, reach out to students individually about their process. I think even for me, when I was transitioning to my clerkship, I think after the second, third week of psychiatry, he sent me a message. Hey, how's it going? Like, how are you adjusting? Let's talk. And I'm like, wait, what? Like, the dean wants to talk to me about how it's going with me. Um, and I was shocked. I was very like, it made me feel important. And it's also very genuine. It's not artificial. It's not like a chat GPT conversation. It's a very genuine, sincere conversation. And I'm glad that I have this to also look forward to when I'm trying to match, that he's going to provide me with his expert opinion and expert um, guidance and insight. So that's really good.
Yeah,
Um,
absolutely. I mean, he gave me a lot of feedback during my application, like different strategies and timelines and whatnot, everything.
Amazing, amazing. Yeah, you don't get that often. So it's
Nope.
really is a privilege and a luxury that we have as IUHS medical students. Um, so one question, which is on the list of questions to ask you, and also I'm very curious myself personally, is how did coming from a Caribbean medical school impact your residency application? And did you feel there was any stigma in any of your interviews? I think as Caribbean students, we always have like an imposter syndrome sometimes, where, oh, I don't want to tell people I'm a Caribbean. I feel bad. I feel, they're going to judge me or look at me differently. Did you feel like that played into your residency application and even in your interviews?
It stigma is a very strong word, so I'll take that out. But yeah, to your point, there is definitely a perception challenge that you went to Caribbean medical school, but I think I focused on what I could control. I can't control that I went to Caribbean medical school, right? But it's like there are modifiable factors and non-modifiable factors. So there were certain things that I could control, and I'm like, okay, I want to do well on those things. Few things like strong step scores. Step one is pass fail, but step two is a strong nowadays consideration for schools when it comes to these competitive exams. So they look at your step two score. They look at if you have any failures or repetitions in your step exams, either step one or step two. So definitely, I would strongly, strongly, strongly recommend all the IUHS students that take your step exam when you are ready. Do not fail and then retake. It won't close your window or anything, but it definitely will impact your like chances of getting interviews. The other thing is a solid letter of recommendations. And that was because, as I said earlier, let the physicians write your work into words. And then, last but not least, proving myself during the clinical rotations. So all the physicians and even my sub-Is that I did during my fourth year, they knew me as a person, like how well I'm doing or what are the things I'm lacking, and they would give me a feedback, and all those things would help me. And yes, there were some they would say like, "Oh, you don't know this because you went to like a foreign medical school." So I would accept the feedback and work on improving those things. So overall, I would say I let my work speak for itself and overcome that helped me to overcome this Caribbean medical school thing or imposter syndrome or whatsoever.
Hmm. Hmm. Very, very good points. And I'm also living that right now in my clerkship when I interact with different medical students, US MD students, Caribbean students. And I think one other aspect of it is how confident are you yourself, right? I think a lot of it is like we subject to ourselves that, oh, they're judging me, they're looking at me differently. when in reality they might not even care, right? Or even if they do care, if you're very confident in yourself that you say, you know what, my board exam scores speak for themselves.
Yep.
My competency, my clinical skills speak for themselves. If you're confident in yourself, I think that is a whole different, it really changes how the dynamic works in your head about how others perceive you. Um,
Yeah. Actually, the fourth year rotations, which are really a time for you to prove yourself. And then I would strongly recommend people to save your fourth year rotations to where you really want to match. If you were, for example, in your case, if you want to match into anesthesiology, then you should do like anesthesia electives and sub-Is at places where you think will be a good fit for you, because it will be a chance for you to explore whether that place is a good fit for you, and it will be a chance for them to learn about you and to see if you are a good fit for their program. So save all your fourth year rotations. We only have 32 weeks. And if you are applying into, like, I did neurology and neurosurgery rotations, I did neuro interventional, neurocritical care rotations, and ICU rotation, medicine, and lot of different rotations, just, to get a taste of it, because this is your time. Fourth year is the only time when you are like, okay, this is where I want to go, and I want to explore more about it, and I want to go into places so they can know about me and I can learn about their program. And if they like you, honestly, you will have very, very high chances of getting interviews. Not just the interviews, even they will rank you high, because, as I said, your work will speak for itself.
yeah, definitely. And this is actually something you told me. I think when I was thinking about my electives, I wanted to just do whatever's convenient, whatever's around
Yeah,
me. And
yeah,
you really opened my eyes and said, like your electives are they may even be more important than your application, right?
of
Because you're
course.
actually face to face with them. You're not just a piece of paper. Like they see your face, they see your sense of humor, they see your charisma, they see your patience, they see how hardworking you are. So it's very important to use those fourth year electives wisely. So thank you for pointing to those.
Yeah,
And
because the place I matched at St. Joe's in California with UC Davis, I rotated with them. It was it was, I think, one of the most difficult contract that IUHS has to do with them, because they were so much back and forth. They were just not ready to accept a Caribbean medical student. But
mhm.
somehow, because I was local and I was like hard, I'm like, please accept me, give me a chance, and all these things. And there was a lot that went into it. And again, shout out to Clark and Dr. Barry to made it possible. So I can rotate with them, and they liked me. I liked their program. I ranked them high, and here I am matched with them.
Yeah. And you're very persistent. Like I know you. Like if you want to get something done, you get it done, which is very good, which is I think a trait I need to actually adopt a little bit. Um, So I'm trying to make sure we didn't miss any questions about the residency application, because I think a lot of the students, I think this is their main concern. They want to set up themselves to be as competitive as possible. So just to finish off this component of the interview, if you want to summarize just the key experiences that helped you match into a residency as competitive as neurology and and as competitive as the site that you actually matched into. If you were to highlight some of the key experiences, key things that you think actually put you above others, what would they be?
Sure. It's as I said earlier, how good you are as a person when you're rotating. So for me, doing a neurology electives and sub-Is and neurosurgery as well at US hospitals, mostly in California, but I went to Illinois as well, at University of Illinois. It helped me a lot, actually. It not just learning neurology, but also connecting with the other residents, connecting with the attending physicians and with the program coordinators in the field, who gave me a great advice, by the way, about how to excel in the whole match process and what are the key things that I have to take, like, focus on. Any opportunity to show interest in neurology, like case presentations or taking a proactive stance in I remember when I was in Illinois during my rotation, there were some rare cases and all, and I would
Mhm.
proactively say like, okay, I'll read about it and I'll do the like a little, a case presentation, like just among ourselves, like I'll give us like a short talk about it. And then they see it, they see like, oh, you are proactive, you are asking them, so don't wait for them to ask you, because mostly they want, they know that you're busy, you are navigating so many things. But if you are proactive and then you are asking them like, hey, I'll read about it, I'll read the current trends that's going on in like multiple sclerosis or normal pressure hydrocephalus or something, and I'll do like a mini talk tomorrow after our round. So those things will really help, because they will know that, yeah, you really into it. And I think all these things collectively help my application stand out a lot.
hmm hmm Just a reminder to the students watching this, the points and insights that Dr. Abhinav is giving isn't specific to neurology. Like you could just replace neurology with whatever specialty that you're interested in and do the same things. Don't think this only applies to neurology students or people interested in neurology. The points that he's giving you guys about, he's giving us about stuff to do to set yourself above others in your application, you could apply that to every single specialty. So definitely take note of those. I know I am, and I'm definitely gonna be applying it into um, my calendar with getting
Yeah.
new experiences and
No, it
volunteer
applies
opportunities.
to everything. It's not just limited to, I'm just saying my
Yeah,
personal
of
experience because I don't want to give like a generic answers or anything. So I'm
course.
just talking my personal experience. But yeah, it applies to the all branches of medicine, all subspecialties or anything.
hmm Exactly, exactly. All right, so now we are at the final component of the interview where we're going to be talking about your final thoughts and then your closing remarks for future IUHS students. So, as for your final thoughts, I wanted to ask you if you could go back and do anything differently in your journey when you started medical school on day one, what would it be?
That's a difficult question. You're telling me to go back to 4 years, think about my preclinical years again.
Yeah.
Which I don't want to, but yeah, just to share a little bit, I wish I would have started networking and exploring different options, or I would say enormous options that were available for medical students earlier in my career, in my medical school journey, which include not just like doing the research or anything, but building connections with the other students who want to go into a same specialty, and getting involved in the specialty or field sooner could have made a process little smoother. But I was still lucky. I think I was in my end of second year when I learned about American Academy of Neurology and the Neurosurgery Academy Society as well. And I started going to the conferences. And during my third year, when I was in my clinical years, that's when I was able to do the presentation at the conference. And this year at a neurology conference, after I matched, so in my second year, I took a course. It was a workshop on neuro-ophthalmology and neurovestibular sciences. And 2 years later, this year I was teaching a course, the same course. So it was
Wow.
just I was very honored to be a part of that course and all. So yeah.
Yeah. I think.
And then the other piece of advice is don't let yourself sit back like, oh, nobody ever matched to, let's say, for example, neurosurgery or anesthesia in your case. So I don't think I'm going to match. No, you got to try. There are very high chances that you will match if you really, really show your passion and if you want to go into something. So don't just sit back and say like, oh, I'm an IUHS or a Caribbean graduate or IMG, so I'm just not going to apply. No, then it will
Mhm.
haunt you, I think, for the rest of your medical career if you don't put your effort into something that you really, really love.
Very, very good points. I think if it was up to me, the one thing I would change about your journey would be for you to wait 2 more years so we could start at the same time, so we could graduate together. But
Hello.
Unfortunately, you didn't wait for me. But thank you for your for just telling us about your journey. And I want to give you this opportunity to talk about any closing remarks you have for IUHS students.
Yeah, to everybody, I know I was in your shoe not too long ago. So I know how difficult and how frustrating at times it is during the during the preclinical years. Especially block 9 and 10, I know is difficult. There are so many things that we have to go through during block 9 and 10 to get through like the step exam and all. But one thing to remember is IUHS as a school, as an academic institute, is ensuring that you are solid and ready for this beast exam. It's a difficult exam. It puts you at a place where you are sitting in front of the computer screen for 8 hours and answering one question after the another, one after another. You are under immense pressure. So that's why IUHS has all these exams like exit exam and subject and NF exams, and a lot of different exams. So it don't underestimate the persistence. Show genuine interest in what you want to do. And um, looking back at this whole journey, I think it has taught me where you start doesn't really define where you can go, because initially I was like, okay, I'm just going to apply to medical school. Let's see if if I match or not. If not, then at least I will have an MD. But matching into a neurology, that too in California, at my number one choice or number one ranking institute from a Caribbean medical school, it wasn't easy, but with the hard work, support from school, a lot of support from IUHS, and belief in myself, I made it happen. And I think to any student out there who is watching this, know that your path is valid, your dreams are possible, absolutely possible, and every challenge that we encounter during the preclinical years and even during the clinical years is actually shaping you into a physician that you are meant to become. So keep pushing forward. You have got this. Sky is the limit. Explore what you want to do, what you really love, and go for it. Don't sit back and say like, oh no, I'm in IUHS, I'm IMG. It's not possible. It will be possible. I was in the same shoe because I was thinking like, oh, I'm not going to get any neurosurgery interviews because it's one of the very competitive residencies. But surprisingly enough, I got neurosurgery interviews, and then they were very positive. I ranked them little low because, as I said, I want to go into neurology first. But I think to me, I felt like I have good chances of getting into neurosurgery as well after my interviews. So.
Wow. I think after that closing remark, I'm wondering why you didn't go into psychiatry or motivational speaking. Like you motivated me so much. It's 11:30 p.m. I think I'm gonna drink coffee and do some UWorld and just believe in myself and keep pushing. Thank you so much, Abhinav, Dr. Abhinav. It is now
My
um, for
pleasure.
for giving us your time. I know I'm gonna keep pestering you with questions on WhatsApp throughout my next 2 years, so you're gonna have to deal with me.
Sure.
Um, yeah. So if other students, if you have any questions, feel free to leave them in the comment section below. I'll remind Dr. Abhinav to take some time out of his very busy doctor schedule to reply to you guys. And yeah, definitely ask him because he's obviously um, a clear success story. And he knows what he's doing. He's very experienced, he's very wise. So definitely benefit from him as much as you guys can, as much as I am doing myself. And if you have any questions or concerns about, um, or at least interests about different specialties, or different ideas that you guys want IUHS to make videos on, definitely leave those in the comment section below as well. The team at IUHS, on the staff, the faculty, they're very enthusiastic about making more videos to help the students. They always ask me if I'm interested in different kind of projects. So if you guys are interested in a particular topic, I know the faculty at IUHS is definitely very eager and very enthusiastic about helping us as well. So leave those ideas and questions and whatever else in the comment section below. And hopefully we'll see you guys in the next video.
Thank you and good luck, everybody.
All right, bye-bye.